which of the following: adult onset, obesity; B, juvenile onset, lean build; C, autoimmune; beta cell destruction; D, peripheral insulin resistance. B, juvenile onset, lean build, and C, autoimmune; beta cell destruction. The most common cause of hypoglycemia is what? A, not eating enough; B, injecting too much insulin; C, unusual amounts of exercise; D, taking glyburide. B, injecting too much insulin. Diabetic ketoacidosis is characterized by which of the following? It takes days or weeks to develop. B, deep rapid respirations; C, usually occur in the elderly that do not have access to water. D, acetone breath. B, deep rapid respirations; D, acetone breath. The following drug is classified as a sulfonylurea: A, glyburide; B, metformin; C, insulin; D, none of the above. A, glyburide. Sulfonylureas work by A, increasing peripheral insulin resistance; B, increasing insulin by production; C, mimicking insulin; D, blocking glucagon receptors. B, increasing insulin production. The following are considered neuroglycopenic symptoms of hypoglycemia: A, seizure; B, sweating; C, palpitation; C, tremulousness. A seizure. The dehydration experienced by hypoglycemic patients are caused by A, sweating; B, increased body temperature; C, decreased renal function; D, sugar drawing fluid out of the cells. D, sugar drawing fluid out of the cells. The first medication typically given to a type 2 diabetic to help control their blood sugar is A, metformin; B, insulin; C, glyburide; D, sulfonylurea. A, metformin. What causes the hunger experienced by hypoglycemic patients? Cellular starvation. In type 1 diabetes, this degree of beta cell destruction is usually present before any symptoms are detected. A, 5 to 10%; B, 10 to 40%; C, 45 to 80%; D, 85 to 90%. The renal problems suffered by many diabetics are caused mainly by A, chronically high levels of sugars; B, chronically low levels of sugar; C, chronic exposure to exogenous insulin; D, chronic exposure to metformin. A, chronically high levels of sugar. Insulin's main function is to A, facilitate movement of sugar from the GI tract; B, facilitate entry of sugar into cells; C, metabolized sugar; D, change carbohydrates to simple sugars. B, facilitate entry of sugar into cells. An A1C measurement is valuable to the patient and physician because it A, is faster than a blood sugar; B, is less invasive than a blood sugar; C, provides an average blood sugar over months; D, provides an insulin to sugar ratio. C, provides an average blood sugar over months. A diabetic patient is suddenly feeling sweaty, anxious, and jittery. The most likely explanation is A, too much food without enough insulin; B, too much insulin with not enough food; C, low blood sugar; D, high blood sugar. A, too much insulin with not enough food, and C, low blood sugar. Why should diabetic patients that take long-acting sulfonylureas should never be signed off? Rebound hypoglycemia. The following are side effects to treatment of DKA with fluid: adult respiratory distress syndrome; B, cerebrovascular accident; C, myocardial infarction; D, cerebral edema. D, cerebral edema. Which of the following signs and symptoms are common to both HHS and DKA? A cust schmaltz breathing. B. Acetone breath. C. Abdominal pain. D. Nausea/vomiting. C. Abdominal pain and D. Nausea/vomiting. How does metformin work to lower blood sugar? Reduces glucose formation in liver and increases glucose uptake in cells. The long-term effects of diabetes are most often caused by A. Brain damage from repeated seizures. B. Vessel damage from sugar molecules. C. Vessel damage from beta cell fragments. D. Skin damage from repeated insulin injections. B. Vessel damage from sugar molecules. During periods of high blood sugar, the cells are A. Overworked, trying to deal with all the sugar. B. Starved. C. Fluid overloaded. D. Hypoxic. B. Starved. The usual first-line treatment for type 1 diabetes is A. Diet and exercise. B. Metformin. C. Glyburide. D. Insulin. D. Insulin. Deep rapid respirations are seen in which diabetic complication? A. Diabetic ketoacidosis. B. Hyperglycemic hyperosmolar state. C. Hypoglycemia. D. Retinopathy. A. Diabetic ketoacidosis. Which of the following medications is least likely to cause hypoglycemia? A. Insulin. B. Glyburide. C. Glimepiride. D. Metformin. D. Metformin. Why is it that elderly patients often do not get the typical warning signs that their blood sugar is getting low? Autonomic system not as responsive with age. What is the most common precipitating factor to DKA or HHS? A. Myocardial infarction. B. Cerebrovascular accident. C. Pancreatitis. D. Infection. D. Infection. Metformin works by A. Enhancing insulin secretion by stimulating beta cells. B. Lowers glucose production by liver. C. Increases renal function. D. Increases gluconeogenesis. B. Lowers glucose production by liver. Hyperglycemic hyperosmolar states usually develop over which period of time? A. 4 to 5 hours. B. 6 to 8 hours. C. A day. D. Days to weeks. D. Days to weeks. Glucagon is A type of insulin. B. A drug that enhances endogenous insulin secretion. C. A drug that enhances blood sugar levels through releasing stores. D. A type of metformin. B. A drug that enhances endogenous insulin secretion. Polyphagia is defined as A. Excessive thirst. B. Excessive urine output. C. Sleep deprivation. D. Excessive hunger. D. Excessive hunger. Glucagon works by A. Releasing stored glucose. B. Enhancing cell permeability to glucose. C. Enhancing glucose absorption through the GI tract. D. Storing glucose in the form of glycogen. A. Releasing stored glucose. What is the mnemonic for anticholinergic toxidromes? Hot as a hatter, blind as a bat, dry as a bone, red as a beet, med as a hatter. What is considered the king of anticholinergics? Atropine. What is the sledge mnemonic for cholinergic toxidromes? Salivation, lacrimation, urination, diarrhea, gastrointestinal distress, emesis. What is the dumbbell's mnemonic for cholinergic toxidromes? Diarrhea, urination, meiosis, bradycardia, emesis, lacrimation, lethargy, salivation. What is the classic presentation for opiate toxidromes? CNS depression, respiratory depression, meiosis. What are some complications with opiate toxidromes? Tachycardia, decreased bowel sounds, peripheral vasodilation with hypothermia, hypotension, respiratory depression and subsequent coma can be fatal. What is the classic presentation for hypnosedative toxidromes? Respiratory depression, bradycardia, hypotension, poor coordination, slurred speech, ataxia, lethargy, disinhibition, decreased muscle tone, nystagmus, neurological depression, stupor, coma. What is the classic presentation of sympathomimetic toxidromes? Tachycardia, hypertension, hyperthermia, hyperreflexia, mydriasis, diaphoresis. What are some other associated signs/symptoms of sympathomimetic toxidromes? Pressured speech, flight of ideas, paranoia, bruxism, tremors, chest pain, rhabdomyolysis. What are the indications of bronchoconstriction? Respiratory distress and suspected bronchoconstriction. What conditions need to be met in order to give salbutamol in bronchoconstriction? Age, none level of awareness, none heart rate, none respiratory rate, none systolic blood pressure, none other, none. What conditions need to be met in order to give epinephrine in bronchoconstriction? Age, none weight, none level of awareness, none heart rate, none respiratory rate, BVM ventilations required systolic blood pressure, none other, history of asthma. What are the contraindications of salbutamol? Allergy or sensitivity salbutamol. What are the contraindications of epinephrine? Allergy or sensitivity to epinephrine. What is the dosage of salbutamol for a patient less than 25 kilograms? MDR rate, 1 puff every 4 breaths dose, 600 mcg/6 puffs dosing interval, 5 minutes max number sign of doses, 3 nebulizer dose, 2.5 mg dosing interval, 5 minutes max number sign of doses, 3. What is the dosage of salbutamol for a patient greater than 25 kilograms? MDR rate, 1 puff every 4 breaths dose, 800 mcg/8 puffs dosing interval, 5 minutes max number sign of doses, 3 nebulizer dose, 5 mg dosing interval, 5 minutes max number sign of doses, 3. What is the proper dosage equation of epinephrine? Intramuscular concentration, 1 mg per milliliter equal 1,000 dose, 0.01 mg per kilogram max number sign of doses, 1 for bronchoconstriction, 2 for anaphylaxis. What is a contraindication for the nebulizer? Fever, declared febrile respiratory illness outbreak. What are the conditions that need to be met in order to give epinephrine in moderate to severe allergic reactions? Age, none weight, none level of awareness, none heart rate, none respiratory rate, none systolic blood pressure, none other, for anaphylaxis only. What are the indications for moderate to severe allergic reactions? Exposure to a probable allergen and signs and/or symptoms of a moderate to severe allergic reaction to systems involved. What conditions need to be met in order to give diphenhydramine aka Benadryl in moderate to severe allergic reactions? Age, none. Weight, greater or equal to 25 kg. Level of awareness, none. Heart rate, none. Respiratory rate, none. Systolic blood pressure, none. Other, none. What are the contraindications for diphenhydramine aka Benadryl? Allergy or sensitivity to diphenhydramine aka Benadryl. What is the dosage of diphenhydramine aka Benadryl for a patient greater or equal to 25 kg and less than 50 kg? IV and IM dose, 25 mg. Dosing interval, none. Max number. Sign of doses, 1. What is the dosage of diphenhydramine aka Benadryl for a patient greater or equal to 50 kg? IV and IM dose, 50 mg. Dosing interval, none. Max number. Sign of doses, 1. What are the indications for nausea/vomiting? Nausea or vomiting. What conditions need to be met in order to give dimenhydrinate aka Gravol in nausea/vomiting? Age, none. Weight, greater or equal to 25 kg. Level of awareness, unaltered. Heart rate, none. Respiratory rate, none. Systolic blood pressure, none. Other, none. What are the contraindications for dimenhydrinate aka Gravol? Allergy or sensitivity to dimenhydrinate or other antihistamines, overdose on antihistamines or anticholinergics or tricyclic antidepressants. What is the dosage of dimenhydrinate aka Gravol for a patient greater or equal to 25 kg and less than 50 kg? IV and IM dose, 25 mg. Dosing interval, none. Max number. Sign of doses, 1. What is the dosage of dimenhydrinate aka Gravol for a patient greater or equal to 50 kg? IV and IM dose, 50 mg. Dosing interval, none. Max number. Sign of doses, 1. In order to administer dimenhydrinate aka Gravol through IV, what must you do first? Dilute dimenhydrinate aka Gravol with normal saline or sterile water with a ratio of 1:9. What are the indications for cardiac ischemia? Suspected cardiac ischemia. What conditions need to be met in order to give aspirin aka ASA in cardiac ischemia? Age, greater or equal to 18 years. Weight, none. Level of awareness, unaltered. Heart rate, none. Respiratory rate, none. Systolic blood pressure, none. Other, able to chew and swallow. What are the contraindications for aspirin aka ASA in cardiac ischemia? Allergy or sensitivity to ASA or NSAIDs, if asthmatic, no prior use of ASA, current active bleeding, CVA or TBI in previous 24 hours. What conditions need to be met in order to give nitroglycerin aka nitro in cardiac ischemia? Age, greater or equal to 18 years. Weight, none. Level of awareness, unaltered. Heart rate, 60 bpm to 159 bpm. Respiratory rate, none. Systolic blood pressure, normotension. Other, prior history of nitroglycerin use or IV access obtained. What are the contraindications for nitroglycerin aka nitro in cardiac ischemia? allergy or sensitivity to nitrates. Phosphodiesterase inhibitor use within previous 48 hours.